Hello and welcome. This is Jordan. I'm the Orthopedic Program Manager at Providence St. John's Health Center. This video is designed to go over the discharge process. What's involved, what's required, what are the criteria that must be met before you can be discharged. First and foremost, we want to ensure that you are medically cleared to go home. So this means that the hospitalist or the internal medicine doctor that's seeing you will ensure that everything is stable. That means your vital signs are stable. Is your blood pressure okay? Your heart rate, your oxygenation, are all those things where they need to be. Your lab work should be stable as well. We're looking for blood levels and things of that nature. We want to make sure that you're transitioned off of all IV medications. This includes pain medication and medications for nausea and just fluids in general. We want to be able to ensure that you're able to tolerate medications and food by mouth. This means that you're not feeling nauseous and that you can swallow these things okay. It's also important that we make sure that you have bowel sounds present and that you're passing gas. It's not part of the criteria that you're having a bowel movement, but are things starting? Are we getting the precursors for a bowel movement? So that means bowel sounds and passing gas. And then we also need to ensure that your pain is well managed. So our goal is a 0 to 4 out of 10 on that 0 to 10 pain scale while you're at rest. We expect that your pain's going to be increased when you're up and moving around, but is it well managed while you're in bed? Once we know that you're medically cleared, it's also important to ensure that you're functionally cleared. So this is something that physical therapy will do. They want to clear you and make sure that you're able to walk at least 50 to 100 feet, which most of you will be doing far more than that. We need to make sure you can transition in and out of bed and in and out of a chair. So can you get up on your own or with minimal assistance from the bed, from the chair, etc. We need you to demonstrate the ability to go to the bathroom, dress, and do all the basic self-care activities. If you have stairs at home, can you go up and down those stairs safely? And we want to make sure that you have all the equipment that you need that the physical therapist has recommended. So our equipment manager here at the hospital will get the order from the physical therapist or the occupational therapist and deliver everything to the bedside. Once you have been medically and functionally cleared, there are several things that need to happen from the nurse's perspective in order to get you ready to go. So they are going to prepare your discharge paperwork. They will go over it with you before you leave the hospital. It includes instructions about how to take care of your incision, what to look for, your medications, etc. We're going to give you an extra dressing and an additional pair of TED hose or compression stockings so that you can swap them out and wash them and still have a pair to wear. The only time you'll need to change the dressing is if it looks soiled or won't stick anymore. We recommend that you get your medications filled at a nearby pharmacy that will deliver to the bedside here. That's something that your nurse will arrange for. We will fax the medications over to them, and they'll come and they'll pick up the hard copy of the narcotic prescription, and they'll drop off all the medications to you in your bed. If you have a copayment due, they will take payment when they drop off the medications. They'll bring a credit card reader or they can take cash. So that's the only time that you'll need to ensure you have a form of payment with you. And again, the equipment will be delivered to your room. So whether you need a walker or a cane or any of the other occupational therapy equipment, it will be delivered to your room. If you have any further questions about the discharge process or what to expect on the day of discharge, please don't hesitate to reach out to me. Again, this is Jordan Spiegel. I'm the Orthopedic Program Manager here at Providence St. John's. My email address is on the screen, and you can reach me by phone as well at 310-829-8079. Thank you for listening, and we'll see you soon for your surgery.